stories on your part?
The one I'm thinking of is someone who was seen at North Shore, who was a middle-aged guy who, as the BHC said, had had a very hard life, and he'd had motorcycle accidents, and he'd had closed head injuries, and he'd had an alcohol problem, and he had done a lot of bad stuff to his brain and to his body. And so he was coming into the clinic because he had sort of chronic pain and orthopedic problems, and he was seeing Dr. Gurn, the medical director, and he was functioning very poorly. He was extremely unhappy and nearly bedridden, both because of his pain and because of the depression. And he got referred to see the behavioral health consultant, but he was reluctant to go, and he's not crazy, and there's nothing wrong with him. And Dr. Gurn, who is a tremendous booster of this program, explained why he was recommending this consultation for what he thought were good reasons. And so this is somebody who would never in a million years have gone to see a mental health provider, but was suffering a great deal. And there were issues about, was he suicidal? Was it, middle-aged man, divorced, alcohol issues, history of anger problems, chronic pain. He's like a poster child for suicide risk. And he engaged with the behavioral health consultant, who he's seen a number of times, and he's been somebody who's been difficult to treat with medications, and quite a number of side effects. Didn't respond to the usual stuff. We had to do something that was somewhat less conventional. But he's hooked in, and he keeps coming, and we keep working with him, and is he well? No. Is he recovered? No. He's still alive. He's still coming to see us. We're still working on it with him. And so that kind of thing would probably not have happened, in my opinion, in as helpful a way with Dr. Gurn, though Dr. Gurn is a marvelous, caring physician. Dr. John Kern, I'm a psychiatrist. I'm the chief medical officer at Regional Mental Health Center. We're located in Merrillville in East Chicago in northwest Indiana. I've been in community mental health for over 20 years, and we had comparatively little formal relationship with primary care, but what really started our joint venture was my growing concerns about the seriously and chronically mentally ill folks that we see, particularly those who were having medical complications of either their illness or their treatment, and we were becoming increasingly concerned that people were dying on our watch, and we weren't able to get them hooked up with the right kind of medical care. Either people weren't getting out to the doc, or the doc who saw them didn't understand what their special needs for monitoring were.
I'm Jan Wilson. I'm the CEO of North Shore Health Centers in Portage, Indiana. And we opened in '97 and became federally qualified in 2003. And it was very difficult for us to get behavioral health care or any kind of mental health care for our patients, and 70% of them were depressed. And we knew this because we did PHQ-9 testing. And we had a lot of tests in place, but then what do you do with it? It was very upsetting to us because we did have a health care center in the county, but it was very difficult to get in there. The care was not something that made people happy.
And one of the things we learned is that 70–80% of mental health services are provided in the primary care world. And we thought, well, if it's our business to be a community mental health center, if it's our business to have some impact on the quality of services that are provided to the people in our community, we need to be part of this too. And what way is it? Are we a part of it? Is it an advisory way, or a supportive way, or an integrated care way? It has to be different, because if we had 10 times as many psychiatrists providing care in the old-fashioned way as we do now, which we could never have, we still wouldn't have it covered. What we did at the front end is we read about integrated care programs and what kinds had been done. And there's a small hand. At the time we did the research 2.5 years ago, there was probably just a handful of of references to work from, and people who were doing this kind of thing.
And not really integrated like we want it to be.
And they varied, some integrated, some not, and so we kind of we shamelessly stole a little bit from here and a little bit from there, and we said, we'll set it up this way, and then we said, what kind of data do we want to gather? We want to know if people get better, we want to know if their medical care gets better, we want to know if they like it. One of the really cool and interesting things about this work is, as these problems come up, because there's no industry standard, you have the freedom to say, let's work on this. You know, there are lots of smart people out there, but they're not here right now. There's just us, and so we'll figure out the best we can and see how it works. And if it doesn't work, we'll do something different.
Fall back and regroup. That the behavioral health helps because the population we serve, every day they're dealing with depressing things. Their life is poor. They have no job, or they have a job with not very much pay. You know, they're not even worried about their health care. They're worried about keeping a roof on their head, their kids fed, their kids well, in shoes, and they can't even do that. And the bottom line is, it is depressing, and when you can't ever take them out of that environment, even though you're treating them, even though you're talking to them, even though you're giving them tools to help themselves, the environment never gets better. So I think it's more difficult with the population we're serving.
About this, that this is now part of how North Shore does business.
There would never be going back, because it would be a disaster for our patients. It would be harmful. Once you see what you can give them, how could you possibly take it away? It's the best support there is, along with the medications. Medications anybody can give, but this piece is intricate to their getting better, to feeling better, to being able to share their horrible experiences, and, you know, just sometimes day to day, okay, and what are you going to do different today to maybe help you cope with this? Or like a diabetic, feeling like they have control when they're newly diagnosed. Somebody counseling with them about that can make all the difference in the world.
Even people in the same building upstairs but not embedded in the team, doesn't work.
It doesn't.
So that's critical. And if you do that, a lot of good things flow from it. A lot of good, you know, the relationship building and the creation of a collaboration that just happens. A lot of that stuff happens automatically.
It's just a coworker. You work with them every day.
The other thing is, you have to have a psychiatrist involved.
Absolutely.
It can't be. This is my selfish.
No, it's true.
I think it can't be done without me. So, but I think that having a psychiatrist at the other end of the phone is essential.
And I think that they really need to decide up front what they want. Go to all these sites, because now there are more out there and they can see what's out there. And just do their homework, because there are ways to do this, and it's so actually easy if you have the knowledge up front. And a lot of the groundwork has already been broken. So I think that it is possible for anyone. And it's critical in the community health centers and in the community mental health centers to somehow do it one place or the other. I think we're robbing our patients of so much by not integrating. John, and I think I am, and our medical director, are very passionate about this. We realize that the person is a holistic person. They're not either mental or they're not just physical. And the statistics are staggering for the number of people with mental health issues that are, you know, dying at a younger age and everything else. And it's so preventable if they have diabetes or hypertension or any of the chronic illnesses, because if they have constant monitoring and treatment, they will do better. But on our end, they don't feel comfortable going to a mental health setting, and on his end, they feel more comfortable with their counselor than they do venturing out to an unknown place. So by doing both for them, I think it's been phenomenal. You could see the light at the tunnel. I'm not quite there, but I can see that maybe I could be happy. I know I feel better than I did before. And I think that keeps them coming back, and it's not the stigma.